So this episode of the Dr. Youn Show is a little bit of a departure from the usual episode. We're going to be doing an Ask Me Anything episode. So just yesterday, I posted on my Instagram stories asking my followers for questions that they would like me to answer on this podcast. And so I got a whole variety of questions ranging from asking me personal questions to advice about plastic surgery to advice about skincare and a whole lot of other things. So I'm going to try to go over and through as many of them as I can today on this episode of the Dr. Youn Show. I have got a bunch of questions here that you have sent me through my Instagram account, and I'm going to go through as many of them as I can to get you the information that you are looking for. So the first question is, any tips for lip thinning? So thinning of the lips is something that happens to all of us as we get older. There are a lot of options for thinning of the lips. Let's start out with, let's say, the non-invasive options that you may have. So there are topical lip plumpers out there, ones that typically have some type of a irritant in it, like cinnamon. These can be applied onto your lips. They do work to create a temporary plumping effect of the lips. And in general, I think those are nice. They're not going to create anything permanent. If you've got, let's say, a party to go to or an event, then they can work very well. Make sure you bring it with you. So put it in your purse or in your pocket, and that way you can reapply if the effects are starting to wear off. I'm not a fan of like lip plumpers, like there are actual physical lip plumpers, like suction cup devices that you can put on your lips. That can create permanent bruising. It can get broken capillaries or telangiectasias from it. And so that's not something that I in general recommend. What else can you do to help plump up your lips? Well, you can also have injections. Injections really are going to be the most effective way to do it. The easiest way to get a minor of what appears to be plumping of your lip, even though technically it's not, is the Botox lip flip. And this is a procedure where you inject the tiniest amount of Botox in the cupid's bow of the lip. And I usually will do like a unit and a half in each part of the cupid's bow. That causes the lip to evert outward and to make it look bigger. Now, the good thing about the lip flip is it's not very expensive. You use the tiniest amount of Botox and it's not as painful as lip injections of, let's say, filler. But the bad thing about the lip flip is it only lasts a couple of months. And so that's a problem. Now, if you like it, then you could try using Daxify to do a Daxify lip flip. That may last a little bit longer, but that's the big negative of the lip flip, is just longevity isn't great. You can also do filler. And so you can do filler with off-the-shelf hyaluronic acid fillers like Restylane and Juvederm, or you can do it with fat. Fat is more of a minor operation. If you do it with these off-the-shelf fillers, results last anywhere from 6 to 12 months. It's painful though. To get your lips injected, it's not fun. I do lip injections. I hate doing them, honestly, because I feel bad because it hurts my patient, not me. It hurts a lot. And I always feel bad causing pain in somebody. You can also do fat. Fat is nice because what stays can stay long-term, years. The problem with fat is only a very small percentage of the fat that is grafted will actually stay. Only maybe 10, at the most 20%. And so at the most, you get a very subtle enhancement with fat, but that can last a long time. Okay, well, speaking of fat, what do you think about fat dissolving injections? So fat dissolving injections started out as a treatment called mesotherapy. Mesotherapy was injections of a doctor's kind of witch's brew concoction of caustic substances that would melt fat. But the problem with some of these is that not only would they melt fat, but they could create infections, they could create inflammation, and maybe even destroy the skin. And so I'm not a big fan of, in general, mesotherapy because it's not been standardized, but there is a standardized form available called Kybella. Kybella is made with deoxycholic acid. This is a naturally occurring substance in our GI tract that basically dissolves fat. And that has been created in a lab for us to inject safely into small areas of fat. And it's FDA approved for the double chin fat. And I do that on patients fairly regularly. I know there's some people who are not a fan of it because you can get quite intense swelling from it, but it does work in most patients. So what do I think about Kybella? I think it works for most patients, but if you've got loose skin, if you've got drooping of the muscle, it's not going to do anything for that. I think it's great for people who've got double chin fat, but the skin is still nice and tight. I also use it for the fat of the armpit roll because that can slowly dissolve that away. The benefit of it, it's non-surgical. The dissolving the fat happens slowly. So if you've got a little bit of loose skin, you have the option of potentially stopping the treatment before the skin gets looser than you want it to be. And so there is a control aspect of it that in some ways can be better than, let's say, just lipoing fat underneath the neck. But you do get a good amount of swelling. It's very expensive. I wish they would bring the price down, but they just won't. And you do need multiple treatments for it. So I think it works well, not for everybody, but I also don't agree with some of the doctors out there who are completely vilifying it. Your thoughts on Sculptra? I'm wanting a facelift in the future. Yeah, so Sculptra is a filler. It's a filler where essentially you inject it into the skin or underneath the skin and it creates collagen. It's a biostimulator essentially. And so you can get filling effect from it, but there are people who have found that isn't just collagen creation, but probably creation of granulation tissue, which is kind of like reactive tissue as well. And that could end up becoming kind of like scar tissue. So there are some doctors who have found that when they're elevating the skin of a facelift, if somebody has had Sculptra injections in that area, then it can be harder to elevate and dissect that area than in somebody who hasn't had injections of Sculptra. And so in general, my recommendation is if you know you're going to have a facelift in the somewhat near future, then I wouldn't necessarily, or even in the future period, then I wouldn't necessarily inject Sculptra along the jawline or areas that the face is going to be lifted. If you want to inject it into the temples, which I do quite often, I think that's fine. The cheeks, I think that most likely would be fine. But definitely when you're looking at the lower face and the neck, you may want to avoid Sculptra in that area. Next question is on fat transfer to the breasts. What's your opinion on fat transfer to the breast? Does the fat get reabsorbed and need to be redone? And can you do it more than once? So this is kind of an interesting question. I have talked to patients about this a lot because people ask me a lot. I don't do a lot of fat grafting to the breasts, and I'll explain why. So fat grafting basically is taking fat from one part of your body, purifying it. So we usually liposuction the fat, we purify the fat, and then re-inject it into the breasts. And you think, hey, that makes a lot of sense. You know, your breast is made up, a good chunk of it's made out of fat. Why not just inject fat into your breasts and then you can avoid an implant? Well, the negative in general of fat injections in the breast is that not a lot of the fat stays. About 30 to 50% of the fat that you inject will stay in the breast long term. And so you're not going to get a huge change to the breast if you inject fat. You know, you will get maybe a cup size or half a cup in general if you do fat grafting to the breast. It does entail a lot of liposuction because you got to suck a lot of fat to inject into both breasts, okay? And so that's important. So if you think about it, let's say the average implant size is 300 cc's. In order to get 300 cc's into the breast to stay that way long term, let's just estimate 50% of the fat that is injected will stay. So in order to get 300 cc's larger in the breast, you need to inject 600 cc's into the breast. So now you're talking, okay, you need 600 cc's of fat injected into each breast to get that result. Well, 600 cc's times 2 breasts equals 1200 cc's of fat that you're going to need your fat to inject into your breasts. Now, when we liposuction fat, but along with the fat, you get blood, you get anesthetic fluid, and other types of fluids as well. And so when you liposuction fat, we are liposuctioning more than just fat. We're liposuctioning fat with all these other types of things. And you're lucky if half of the volume that you liposuction is true fat. You'd be lucky if it's true, 50% is true fat. So you need 1200 cc's to get what you're looking for the breasts. In general then, to get that 1200 cc's, you're going to need to liposuction probably at least 2400 cc's. That's 2.4 liters of fat out of somebody. That takes a while. That's a lot of surgery. That's a lot of fat to remove from somebody. And so that's one reason why, it's not a super easy operation. If you're going to do fat grafting to the breast, it's a fairly long operation. But even more important than that, my concern with fat grafting, and this is something that has never really truly been figured out, long term is injecting fat, which is chock full of stem cells, going to increase your risk of breast cancer in the future? And we don't know that. We know that if you look in a few years down the line, the studies are appearing to show that most likely it doesn't impact it, but creation of cancer is not something that just happens over a couple of years. This is something that can happen over 10 years or longer. And so That's my main concern with fat is it's chock full of stem cells. 1 in 9 women will get breast cancer in their lifetime. And now we're injecting a bunch of stem cells into a cancer-prone organ. Are we really doing the right thing when we're doing that cosmetically? And so that's something I think I encourage you, if you're thinking about fat grafting to the breast, definitely make sure that you're okay with that. If you have a family history of breast cancer, then that's something you really want to take into account. And this is something that honestly, other than myself, I've never heard another plastic surgeon bring up this concern. And why is that? You tell me. I think because we are so focused on, as a cosmetic plastic surgeon, we're so focused on the results on the table in front of us that sometimes we don't really look so much in the future of what can happen 10, 20, or 30 years later. And then the other question here is, can you do it more than once? The answer is yes, you can definitely do it more than once. Okay, here's one of the personal questions. How long have you been a surgeon and what made you want to be in your profession? So I have been in private practice now since 2004. So now it's been 20 years, which is like crazy when I think about it. I've wanted to be what made you want to be in your profession? I actually wrote a book about this called In Stitches. It was my first book. It's a memoir that actually won awards and stuff. I'm real proud of it. But what made me want to become a plastic surgeon was kind of multiple factors. I always wanted to work with my hands. And so going into surgery was something that I always considered. But at the same time, I've been an artist throughout my life. I used to be kind of an animator type of a guy. And then I have done a good amount of oil painting. I did a little bit of acrylics. And so artistry has always been something that I've enjoyed. And so kind of combining those two things, it just made a lot of sense. And so there's a lot more to it than that. There are certain patients who have really taught me lessons throughout the way and have inspired me to go into the field of plastic surgery. And I share a lot of that in my book, In Stitches. It is available on Amazon. So if you want to check it out, I'm really, really proud of it, my first one. And that book is all about why I became a doctor and then why I decided to become a plastic surgeon. And it's kind of like my story. If you read it, I promise you're going to like it. I'm so proud of it. I think it's funny and it's entertaining. It's a quick read. Yeah, it's won like the Michigan Notable Books Award. So really proud of it. Okay, I'm 45 and still get acne. What is the best way to combat this? Mostly whiteheads around the nose and random spots. So when you're 45 and you've got acne issues, there are so many factors that can be involved. Adult acne, anything from hormonal. Okay, so if you're 45, and I don't know if this is male or female, if you're a woman and you're 45, and let's say you're going through perimenopause, then those hormone fluctuations with the estrogen, progesterone, and testosterone can definitely create adult onset acne at that time. Also inflammation, if you are having an inflammatory diet, if you are eating a lot of ultra processed foods, if you're having a lot of dairy, you're having a lot of sugar, those are things that can definitely impact acne. And so cleaning up your diet can make a big change to that. Other things that can impact acne would be the health of your microbiome. And so taking a daily probiotic can potentially help with that. Eating fermented foods can help with that. And then once again, acne being an inflammatory condition, what else can cause inflammation to your skin? Stress. Are you getting enough sleep? Are you stressing too much? Should you try meditation? Should you do things to make sure that you're getting better sleep at night? There's a lot of factors that are involved. And then skincare, you can get acne from using the wrong types of products. And so in my opinion, if you're saying, well, geez, I am using a lot of products, but I don't know which one's, making my acne worse, then my recommendation would be to really bring everything down to the basics. Do a cleanser in the morning, apply an antioxidant serum and a sunscreen, and then at night cleanse, and then use a retinol or a retinoid. There is Differin, which is a prescription strength, but is available over the counter now. Or you can use a retinol or prescription strength tretinoin. A lot of options for you. But in general, you're going to want to try to figure out why am I having acne now? Is it hormonal? Is it inflammation? Is it stress? And try to focus on all those things. Anything that you do to improve it, whether stress is causing it or not, if you improve your stress, that's going to be great anyway. I could probably make an entire podcast on that more than just a quick question on an AMA. Okay, here's another personal question. Who is your favorite doctor to beef with? So you may follow me on social media and see that I quote unquote beef with other doctors. It's all for fun. It's never serious. So I have 3 doctors that I'm technically beefing with right now. The latest one is Dr. Charles Lee. He is a Beverly Hills plastic surgeon. I've known him since I was a fellow back in 2003. He let me come to his office for a few days and I watched him do Asian blepharoplasty surgeries. So I've known him since 2003. Dr. Ricky Brown, who I met in 2019, when we're 2 of the early adopters of TikTok as plastic surgeons. And so we have kind of a fake beef that's fun. He's a really good guy. And then the other one is Dr. Subio. He's not on TikTok much. He's more on Instagram, and he's an artist. He's hilarious. And so we've got a on and off beef there that's a lot of fun. So who's a favorite one? I mean, lately, I think it's been a lot of fun to beef with Charles Lee because he gives it right back. Subio is so nice that he has a hard time giving it back sometimes. I think he feels bad. So probably Charles Lee right now has been a lot of fun.
Hey, knock it off. There's a kid back there.
I'm in danger.
Okay, can estrogen cream be used on the face for menopausal women to combat dryness? So yeah, estrogen cream, it's interesting. It has been being used more and more often. The first thing I would encourage you is don't use cream that is made for the vagina. So some people are using estrogen cream in that area and they go, oh, well, if that helps with the dryness there, then why not put it on my face? Well, that's made to penetrate mucosal walls of the vagina. It's not necessarily made for the skin of your face. Now there are companies who are making estrogen cream for the face. Honestly, I haven't looked at a lot of studies with it. I did see one study that did show that applying estrogen cream to the skin did help to increase the collagen of the skin. So I think that's a good thing. And if I remember, I think it's collagen and the hydration of the skin, but I would have to relook at that study to be 100% sure. And so there are companies who are promoting that. The big question is if you are, let's say, on hormone replacement therapy, if you're taking estrogen anyway, is it going to benefit you to use an estrogen cream on your face too? And honestly, I don't know the answer to that. It's just literally, I feel like the last few months that people have been talking about estrogen creams for the face, as more and more people are talking about menopause, I don't think you need it until you have gone through either perimenopause or through the menopausal transition. So if you're, younger, then definitely that's not necessary, but menopausal, it may be helpful, something to talk with your doctor about. And I think we need more studies on it, definitely. Question, just had a breast augmentation and I'm unhappy with my results. How do I address this with my doctor? Well, honestly, honesty is the best policy. If you're unhappy with the results, just ask your doctor to talk with him or her and see what they have to say. Sometimes you may be unhappy with the results and there's nothing that can be done. I get patients who have asymmetry. One nipple is higher than the other, and we put implants in and it stays that way. And sometimes there isn't anything you can do. It's not worth doing a lift because lifts create a bunch of scars, and to trade minor asymmetry for all those scars may not be worth it. Other times there's asymmetry where one breast sits higher than the other, but it's because it started out that way. And the only way to try to impact that could be to create a problem that's even worse than what you start with. And then other times it could be something that you're unhappy with that maybe is due to swelling and that can get better with time, or maybe you're having a complication. So really what it comes down to is communication. You need to be able to talk to your plastic surgeon about your results, and hopefully you're on the same page afterwards. You may not be, and if you're not, that's okay, but it can be a difficult situation. Honestly, that's the worst part of my job, is if I've got a patient who's unhappy with the results and I look at it and I go, wow, I think it's actually a really nice result. And they may say, no, they disagree. What do you do? If there's something that can be easily done to rectify it, then by all means, I try to do that. But if there isn't, and to try to quote unquote fix it may make things a lot worse, then it becomes a different type of a discussion. In the end, it really comes down to communication. And if you cannot communicate with your plastic surgeon, then unfortunately you may have chosen the wrong doctor for you, and you may have to look for somebody different to talk with. All right, still on the topic of surgery, is a second rhinoplasty risky? So rhinoplasty, to my knowledge, is the cosmetic operation with the highest revision rate. So the highest number of people are unsatisfied with their first surgery and they progress to a second surgery. So is a second rhinoplasty risky? It is more risky than the first kind, than the first time. So in general, with rhinoplasty and with any of these cosmetic operations we do, it's always, you have the best chance of getting the best result the first time that it's done. That being said, sometimes, let's say, you take a bump off of a nose and scar tissue builds up a little bit there and that bump looks like some of it has come back. Is it worthwhile to go back and try to remove it? Sometimes it is. And if you're just doing something minor like that, then the risk can be fairly low. But if you're going back in to remove more cartilage and stuff like that in a more aggressive manner, then you can at some point get to the slippery slope where every additional operation, your expectations have to lower. And I have seen that most commonly in patients who've had nose jobs. I've had people come to see me like, oh, I've had 4 or 5 nose jobs already. And you're just like, oh my gosh, your nose is it's a scarred up mess, really, that to operate again is most likely just going to make it worse. And so at some point, you just have to stop. And in my opinion, where's that point? Well, it's not the same with everybody, but if I had to say where that would be, I would say either the second or the third rhinoplasty, you have to stop, because otherwise you do it again and it's just going to make it worse. Here's a skincare question. Too much confusion on skincare. How much is too much and how less is too less? And that's, I think, a great question. And I think the answer for that, you're not going to want to hear this, but the answer lies within you. And what I mean by that is, are you a skincare enthusiast? In which case, maybe doing a 10-step skincare routine you find enjoyable, you find it to be your own alone time, you find it to be time that you can relax and that you take care of yourself. In which case, if you want to do 10 steps and your skin is tolerating it, or maybe even benefiting from it, then go ahead and do that. If on the other hand, you're not that person and you say, look, I really don't want to take the time to put on 10 skincare products, then just do the bare basics, and that is okay. What are the bare basics? Well, in general, I recommend what's called the 2 minutes, 5 years younger skincare routine. It takes 2 minutes a day, and what we studied, people who had quote unquote average skin, and after 2 months, we found that a lot of them looked upwards of 5 years younger. And it's very simple. I have our own 2 minutes, 5 years younger skincare bundle at younbeauty.com. And that skincare very quickly is cleanse in the morning, apply vitamin C serum, and then a sunscreen. At night, you cleanse and then you apply a retinoid. And then once or twice a week, up to 3 times if you really have got durable skin, you want to exfoliate your skin. And that's the basic skincare routine that everybody should ideally do. If you want to add on top of that, then by all means, feel free to do that. But at least start with those basics, that 2 minutes, 5 years younger skincare routine. And if that's all you want to do, then you're still ahead of 98% of people out there. If you want to do more, then by all means, add things to it. You can do more if you want. And once again, that 2 minutes, 5 years younger skincare routine is at my younbeauty.com website. We've got it's our most popular bundle actually of products, 4 products, everything you need other than the sunscreen, the 2 minutes, 5 years younger skincare routine. What are your thoughts on microneedling? So I like microneedling. Microneedling, basically, if you've not heard about it before, it kind of started with the dermal rollers, which look like mini rolling pins that you roll along your skin. Those dermal rollers have tiny little pins that go in, let's say, less than a millimeter into the skin. And the idea is that it creates trauma to the skin. And when you traumatize the skin in a controlled fashion, you damage the collagen. It causes that collagen to heal in a tighter fashion. And so it's kind of like the idea of hormesis. You have a acute controlled trauma to the body, and the body reacts to that by actually being younger afterwards. And so instead of doing a dermal roller in the offices, we do microneedling, where it's a handheld device where those little pins go into the skin in a very specific depth to create enough trauma so that you can cause the skin to become rejuvenated, but not so deep that you create scarring. And microneedling can also, so if all you do is just microneedling, that's a nice treatment. It's not that expensive, but you can do other things with it. You can apply PRP or platelet-rich plasma over the surface of the skin. A lot of people call that like a vampire type of facelift or facial, not facelift, facial. Or other people do like Morpheus 8, which is radiofrequency microneedling. And I know I've got a question on that here as well. Yeah, actually, that's the next question. Here we go. Will Morpheus help with skin tightening on the abdomen after pregnancy? So Morpheus 8 is radiofrequency microneedling, where that needle goes into the skin, but instead of just puncturing the skin, it is insulated all the way up to the tip of that needle. And the tip of the needle emits radiofrequency energy or heat. The heating of the deep skin causes the collagen of the skin to tighten, and now you've got that twofold treatment, where you get the puncture of the needle, creating that acute damage to cause the collagen to tighten, but you've got the heat as well, causing the collagen to tighten even more. And that's why Morpheus 8 is so popular right now for tightening of the skin around the facial areas, because you really can get what essentially is a shrinking of that skin. It's not a lifting, it's a shrinking of the skin by creating that heat. So what about skin of the abdomen after pregnancy? So there is Morpheus 8 for the face and the neck, but there's also Morpheus 8 for the body. We do not currently in my office have Morpheus 8 for the body. I have not used it before. I have been kind of bearish on body tightening treatments, non-invasive body tightening treatments, because traditionally they haven't worked very well. Because the reason why is that you are relying on the collagen of your skin to be damaged, and that damage one skin to cause that collagen to tighten. And it's only going to tighten so much. It's only going to shrink so much. Now, if you've got a small area, like let's say underneath the neck, that you want to shrink, even a small amount of shrinkage of that skin may be visible, it may be palpable, and it may be noticeable. But when you've got a larger area, like let's say a tummy, and especially if that skin is quite loose, then even if you get a modest tightening, you may not notice it because it's such a larger area that you need to see a bigger change for it to be noticeable. And that's my concern with, let's say, Morpheus for tummy skin after pregnancy, is that if it's a small amount of looseness, then yeah, maybe it's worth a try. But if you've got, let's say, skin that's a little bit sagging, if you've got skin that's kind of rolls over itself a lot, that type of thing, then it's unlikely to do a whole lot. And so that's my feeling with Morpheus for the body. I think certain smaller areas of the body, like let's say skin around the knees, can be potentially more effective there. Maybe the upper arms a little bit more. The tummy, just depends on how much loose skin you have. And if it's a lot of loose skin, then unfortunately, it's either a tummy tuck or you live with it. And you may be wasting your money on a treatment like a Morpheus 8. Okay, can you talk about your products and what makes them different from other brands?
Are you challenging me?
Good question. So, one of the things I put in my latest book, Younger for Life, is my story about skincare. And I don't even think I put this in Age Fix because it was before my Age Fix book. It was after my Age Fix book came out that I really realized kind of where I had gone wrong. So when you start your practice as a plastic surgeon, there are various skincare brands that are quote unquote medical grade that advertise to plastic surgeons to carry them in their offices. And so there are certain brands that are medical grade that they tell you, look, you can't buy these online. You can't buy them at a drugstore. You can only buy them through doctors' offices. And these are the brands that a lot of plastic surgeons' offices carry. And I did the same thing. I said, oh, okay, these brands are interested in having me carry their line. We'll sell the products in our offices, and they work. And so we carried a brand, at the time it was called Obagi, very aggressive skincare line. I actually took a course with the originator of that line, Dr. Zain Obagi, really nice guy, like brilliant man. And we carried the products in my office. And we put my patients on it, and they saw immense changes in their skin. People who were their face was just covered with spots, age spots. And 3 months later, their skin was just so bright and so smooth in texture and color. I mean, these just amazing changes in the skin. But I always held a secret that I did not let my patients know or was public with. And that secret was that these same products that I was putting my patients on, seeing these great results with, I could not use. If I were to put these products on my own skin, I would break out in hives. I'd be scratching and itching my skin, and I would break out potentially in pimples and eczema and even perioral dermatitis. And so I learned fairly quickly that these products worked, but they didn't work for me. And so for many, many years throughout my practice, I basically used the basics. I used a very gentle cleanser, and then I would apply, sunscreen, and then I would apply basically a just basic gentle moisturizer. And that was it. Because anything else I applied to my skin would cause me to break out and to itch and scratch and all that. And as I started getting into more alternative and holistic medicine, I thought, they've got some skincare companies that have these natural products. Let me just try them. And it was an eye-opener for me because I would now apply these products that are made with natural and organic ingredients, and my skin would feel good afterwards. I could apply them and not react to it almost universally. And it was this thing that I finally came to this realization that there is an entire, a segment, and this was before people are eating a lot of organic and stuff like that. I mean, this is like before clean skincare became a thing, that I realized that there is this category of skincare products that I can actually use on my skin. But then I started looking at these products more carefully and the ingredients and things. And I'm like, wait a minute though, there is nothing in these products that are going to actually reverse aging. So I can't necessarily recommend these for my patients who come in and they've got age spots and fine lines and wrinkles and texture issues and stuff like that, because they may feel good on the skin, but they're just basically moisturizers they may have antioxidants, but that's about it. And so that's when I created my line Youn Beauty, is because I knew that there was this, space that had not been filled with products that are made with natural and organic ingredients, but have actual scientifically proven anti-aging components like vitamin C, like retinol, like kojic acid, and all those types of things. And so that's the story behind Youn Beauty. Sorry, I went on and on about this, but that was the story behind Youn Beauty. And that's what makes them different from other brands. All right, next question. How would one pick a plastic surgeon? So this is very straightforward. Okay, the next question is, how would one pick a plastic surgeon? This is a great question, and this is something that's very straightforward. Number one, you want to make sure your surgeon is certified by the American Board of Plastic Surgery. That is the only major board that certifies true plastic surgeons. Now, there's a caveat. If you're looking for facial plastic surgery, there is an American Board of Facial Plastic Surgeons that is an equivalent, but you don't necessarily want a facial plastic surgeon to do your breast implants. Face, okay. Breast implants, facial plastic surgeon, not okay. And then there's also a group of ophthalmic plastic surgeons. These are ophthalmologists who have specialized training in plastic surgery of the eyelids. They're also experts with eyelid plastic surgery, okay? So that's the first thing. Make sure they have the certifications. If it's not one of those three, then you want to look for somebody else to do your surgery. Okay, so that's the most important thing. Second thing is you want to meet with that surgeon and make sure that surgeon has hospital privileges to perform the operation you're interested in. And the reason why is because hospitals will vet the doctors and will not let them do operations that they're not actually trained to do. So for example, I have hospital privileges to perform facelifts. I do not have hospital privileges to perform a gallbladder removal. However, if I want to do that in my office, I could convince you to let me take out your gallbladder in my office. There's absolutely no law preventing me from doing that or penalizing me from doing that. It is perfectly legal. And that's how certain doctors get away with this, is that they, will perform these operations in their offices even though they don't have the right training to do so. So make sure your doctor has hospital privileges to perform it. Even if you don't have to do it in a hospital, that's okay. You can still go to an outpatient surgery center. Those are very safe, but make sure they have those privileges to do that. And then you want to meet with them. And if the doctor seems rushed, if they're not listening to you, if they're just trying to sell you, really listen to that inner voice in your head. And if you're feeling like this doctor's kind of creepy, the doctor's, not listening to me, the office is really dirty, the staff is unhappy, look for all those types of things because that's going to also give you an idea. And then the final thing is ask around, look for word of mouth, see who has a good reputation in your area, because obviously that's super, super important. So I have gotten through about half of my AMA questions that I have gotten. So we're going to do another one of these here in the near future to answer the rest of the questions that I have here. You've sent me such good ones that I want to answer them hopefully in as detailed of a manner as I can. And so that's where we're at here. So I'm going to get the rest of these, I'm going to save them, and we are going to go ahead and answer them in a future podcast episode. So I want to thank you so much for listening. And if you've been enjoying this podcast, as always, please leave a rating or review on iTunes, Spotify, or wherever you get your podcasts. It definitely helps me spread the word. And as always, everybody, I'm Dr. Anthony Youn. This is the Dr. Youn Show. Remember to always eat real food, use clean skincare, and auto-rejuvenate before you operate.